Hello, my name is Brianne Jordan, and I'm a baccalaureate nursing student at Indiana State University. This is my health education project for community health nursing on reducing screen time in children and adolescents. Before my nephew was born, I did not think twice about the amount of screen time children are getting. After spending copious amounts of time researching this topic with my sister-in-law, I decided it was important to inform the community about the negative effects screen time has on children and adolescents. I also feel it is important to not only discuss the negative effects of screen time, but to also point out to parents ways that they can limit screen time in their home. I chose to discuss all children under 18 years of age, as this age group is at risk of exceeding screen time guidelines due to their reliance on others to set limits. Before I begin this presentation, please take a few moments to complete the pretest and assess your knowledge regarding screen time in the pediatric population. Today I will be discussing a general overview of what screen time is, screen time guidelines per age group from the World Health Organization, the risks that screen time impose on the developing brain, media's role in poor health choices, how parents can reduce screen time in the home, questions that parents can ask their child's healthcare provider, and then this will all be followed by a question and answer session. So what exactly is screen time? It can be defined as time spent viewing any modern technology with a screen. Some examples of this are television, video games, computers, and handheld devices such as cell phones, tablets, and smartwatches. Screen time guidelines from the World Health Organization were recently changed earlier this year. Currently, the WHO recommends no screen time for children aged 2 years and under. For children aged 2 years to 5 years, they recommend only 1 hour or less of screen time per day. They also note that that hour of screen time allowed should be high-quality programming, such as educational games or television shows. Children aged 6 years and older are limited based upon parental discretion. It is always best to have the parent engaged with the child during screen time. Now that we've defined screen time and talked a little bit about the recommendations from the World Health Organization, I'd like to get into the negative effects that too much screen time can have on children and adolescents. First, I'd like to talk about a particular developmental delay seen in children aged 6 months to 2 years that have access to screen time. The Hospital for Sick Children in Toronto examined 894 children and found that the more handheld screen time a child used, the more likely that child was to have expressive speech delays. Children need face-to-face interaction to develop their necessary communication skills. The same study found impressive numbers in that for every 30-minute increase in screen time, that child's risk of expressive speech delay was increased by 49%. Sleep disturbances are another negative effect that screen time has on the pediatric population. Amazon's Mechanical Turk did a study to determine screen time's effect on sleep for children aged 3 years to 17 years of age. The results showed that sleep duration and quality of sleep decreased with screen time above 4 hours for pre-adolescents and above 10 hours for adolescents. The blue light emissions from screens are thought to disrupt the body's natural internal clock, making it difficult to fall asleep at night. Blue light emissions are also thought to disrupt REM sleep, which is needed for brain development and processing. Lastly, these blue light emissions are thought to suppress the sleep-inducing hormone melatonin. With an estimated 3.2 million adolescents aged 12 years to 17 years in the United States having at least one major depressive episode, parents need to start minimizing the risk factors for depression. One major risk factor is screen time. A systematic review of 32 articles showed strong evidence for the positive relationship between depressive symptoms and screen time among adolescents. The depressive symptom findings and lower levels of self-esteem appeared at 3 or more hours of screen time per day. Teenagers are at risk for the most screen time as they tend to use computers in school, have personal cell phones, watch television, and sometimes have personal tablets. Screen time's negative effects can also be seen in media advertisements. Children are the target audience for many junk food commercials. When a child is watching hours of television, they will see multiple commercials advertising junk food, fast food, etc. After viewing these commercials multiple times, the child will then begin to desire these unhealthy food choices. Sometimes it becomes extreme, and the child will refuse to eat anything other than what they saw on the advertisements. Parents need to talk to their children about advertisements on TV and websites. Children need to be aware of what a sales pitch is and how it can influence them. Discussions on unhealthy food and their ill effects on the body should also take place. Just because it happens on TV does not mean it happens in real life. Children tend to see their favorite cartoon characters indulging in snack foods. Parents need to be aware of this and discuss with their child that this is just an advertisement and this is not the way they need to eat. So now that we know many negative effects of screen time, you may be wondering how you can reduce screen time in your own home. The first step is to talk to your family. Discuss the negative impact screen time has on them and create each family member a chart to track their current screen time usage. It is very eye-opening to some when they begin to track it. Families should also involve children in setting screen time limits based upon the World Health Organization guidelines. Limits need to be enforced and not have any wiggle room. Parents should also be aware they are role models for their children. You, as parents, need to be aware of your own screen time usage throughout the day. If your child witnesses you following the rules, they will more likely follow them themselves without any problems. Creating screen-free bedrooms is also important. As we learned earlier, blue light emissions affect our sleep cycles. Mealtime should also be family time, therefore no electronics during meals. It's also worth noting that screen time should not be used as a reward or a punishment. This type of reward-punishment system makes screen time seem even more important to the child. Since screen time will have limits, children will need to be provided with other opportunities for entertainment. Make a fort together inside, play outside, learn a new hobby, join a sport, build something, make jewelry, color, paint. The possibilities are endless. If you as a parent are feeling uncomfortable with screen time after this presentation, prepare a list of questions to ask your child's pediatrician. Here are some examples that you might want to ask. What are the best educational programs for my child to watch? My child uses a laptop at school. Do I count that as screen time? Should weekdays and weekends have different screen time limits? Screen time guidelines for 6 years plus are described as parental discretion. What should I set my child's limit at? How far away should the screen be from my child? How do I keep my preteen and teenager safe on the internet? I've reserved some time for a Q&A session. Does anyone have anything they'd like to ask about or discuss? The following slide is a list of references that were used in the making of this PowerPoint.